Sampling Plan in Cleaning Validation. Presented by Learn GMP Incorporated in collaboration with Technical Training and Consultation Service LLC. Objectives of a sampling plan. Designing a sampling plan in cleaning validation is a critical step to ensure that residues are effectively monitored and controlled. A scientifically justified sampling plan provides evidence that the equipment is consistently cleaned to acceptable levels. This plan gives you idea how to detect residual product, cleaning agent, and microbial contamination. Assess effectiveness of the cleaning process. Ensure representative coverage of worst-case locations. Sampling methods. There are normally two types of sampling methods: swab and rinse. Swab sampling, used for direct contact surfaces. Target area, typically 25 square centimeters, 5 centimeters into 5 centimeters. Advantages: detects local contamination. Tools: pre-validated swabs, example, polyester-tipped. Solvents, for example, WFI, swab hard-to-clean areas, corners, joints, gaskets, and surface transitions. B. Rinse sampling, used for inaccessible or complex systems, for examples, tanks, piping. Target: collect rinse water after final cleaning step. Advantages: covers larger surface area. Limitation: less sensitive to localized contamination. Collect known volume, for example, 100 milliliters, and analyze for API, detergent, TOC, or bioburden. Sampling locations, worst-case justification. Location type and justification example. Hard-to-clean areas examples are agitator shafts and spray nozzles. Dead legs/corners like uncirculated areas in tanks. Horizontal surfaces more likely to retain residue. Product contact surfaces like tablet press dies and coating pans. Gaskets/seals/valves. These are common points of microbial ingress or residue trap. Tip: use a surface map or photo to show the sampling points in the protocol/report. Number of samples. There is no fixed number. Depends on equipment complexity, surface area, and follow the risk assessment ICH-Q9 approach. Equipment type and typical swab locations. Blender around 4 to 6 swabs from inlet, blade, walls. Fluid bed dryer around 6 to 8 swabs from bowl, filters, outlets, and from granulator 5 to 7 swabs from impeller, discharge chute. Sample recovery study. Before using a swab or rinse method, conduct a recovery validation. Spike known amount of analyte onto test surface. Let it dry, then swab/rinse. Analyze percent recovered. Acceptance. Recovery should be greater than or equal to 70%. Ideal greater than or equal to 85%. Microbial sampling. Use sterile swabs or rinse water. Sampling should be done after cleaning but before sanitization. Surfaces must be dry and at rest. Include contact surfaces like gaskets, manway seals. Sample labeling and documentation. Each sample must be clearly labeled with sample ID, equipment name and location, sampling area, swab/rinse, operator initials and date time. Analytical considerations. Method used, for examples, HPLC, TOC, bioburden. LOD and LOQ must be below MACO or microbial limits. Ensure adequate sample volume and integrity. Final tips. Justify all locations and methods in your protocol. Use a risk-based approach for frequency and extent. Include visual inspection as part of the sampling strategy. Thanks for watching our channel. Feel free to reach us at contact@learngmp.com for any training and consultation requirements.